Hi, I'm Dr. Heather Yost with Yost Wellness Center, and today we're going to talk hormones. We know that 85% of women are going to develop some sort of menopausal symptom. 12% of Americans are going to end up with a thyroid disease. 60% of those aren't even going to know it. 85% of those will also have autoimmunity, and autoimmunity affects 5 times more women than cancer. Autoimmunity is also the leading cause of death for young and middle-aged women. So if you're a young or you're a middle-aged woman, it's not cancer that we need to be aware of. First and foremost, it's autoimmunity. Most doctors aren't testing for autoimmunity. Most doctors aren't doing all of the markers for thyroid, doing any sort of reproductive testing for menopause. We're really kind of stuck in the land of symptom treating. So if you stick with me today to the end of this, I promise it's going to change the way you view symptoms. It's going to change the way you view your health. And most importantly, it's going to change the way you view the healthcare delivery system. But here's the question. Is life just a lottery ticket? Do you just get what you get, or is there something that you can do about it? Because with the sorry state of our healthcare delivery system, we have got to start asking better questions. We're getting sicker, we're spending more money, and our quality of life is going down. So today I'm going to show you how to better understand your body, what your symptoms are actually trying to tell you, how to properly test for these problems, and why traditional medicine isn't testing for them already. And then what to do, like what your next best step would be after testing in order to get well and stay well. It took me a long time to figure this stuff out, but I promise you I can fast track you to get the results that you want. But first, let me tell you just a little bit about myself. Again, I'm Dr. Heather Yost. I am a certified functional medicine doctor in Urbandale, Iowa. And 5 years ago, I had my own health crisis. I went from a very active runner, a very, very active doctor, to really from living my best life to overnight having a shift and a change in my quality of life. And it started with just annoying joint pain that was like in my middle back, and then it went to my low back, and it moved from being annoying to being severe to being debilitating. There were times where I couldn't bend over to get my pants on. There were times where it was hard for me to roll over in bed or even get out of bed to go to the bathroom. There were times where my husband was carrying me around and doing all of the parenting. I ended up at Mayo Clinic, and I spent an entire summer at Mayo Clinic, test after test after test, to get to the reason behind all of these symptoms. And at the end of about $55,000 being spent at Mayo Clinic, we came up with a diagnosis of autoimmunity. And at that point, I knew I was told I would be on drugs or medication for the rest of my life. I would see various doctors for the rest of my life, and I would have to manage the symptoms because there was no root cause. And I knew differently. I wanted something different, and I sought out functional medicine. Hired a functional medicine doctor. I did different kinds of tests to get to the root cause of this happening in my body. And ultimately, 5 years later, I'm an active mama, I'm an avid runner, I'm a busy practitioner, I'm back to living my best life. And that's what I do now for others, is I help them through functional medicine, which we'll go over what that is, get their life back, and fix the cause of what's happening. So here's functional medicine in a nutshell in one picture. You can see, the bottom. I think we all can agree inflammation can cause problems with your health. Poor diet, stress can cause problems, traumas, genetics, poor digestion, nutrient deficiencies. And here's what happens is there's some root cause, and eventually a symptom, from hormone imbalance to thyroid issues to anxiety to chronic fatigue to sleep and so forth, some sort of symptom arises. And in today's traditional medicine, we treat that symptom with some sort of drug or possibly surgery if it needs it or something like that. But if there is a root cause, doesn't it make sense that we should at least do the best that we can to get to the root cause so we can correct it as naturally as possible so the symptoms don't keep coming or more problems are created underneath the surface while we're treating symptoms. So most of you have not probably heard of functional medicine, but most of you have probably heard of Dr. Oz. So Dr. Oz actually has his fantastic 4, which are 4 medical doctors that I like to say have hung up their stethoscopes and white lab coats and started practicing functional medicine. So when we look at the body, depending upon who or what resource you're looking at, there's 11 or 12 primary systems of the body. But they aren't separate systems that are to be divided amongst medical specialties. I mean, if you do have a GI system, who are you seeing? You're seeing a GI doctor. If you have a cardiovascular problem, you're seeing cardiologist. If you've got a hormone issue, you might be seeing, some sort of reproductive endocrinologist, an OB/GYN, or so forth. But listen, your body isn't a separate set of organ systems. Your body is an ecosystem that should work in harmony to create optimal health for you, because the hormonal system affects the detoxification system. The detoxification system affects the nervous system. The nervous system affects the digestive system, and so on and so forth. So you see, everything's connected. For purposes of education, of teaching you, of going over it today, we kind of divide it into these 4 systems that you see in front of you because it makes it easier to explain. But here's the key. You need to know that everything affects everything else. Everything in your body is connected in some way, shape, or form. But today's about hormones, so we're going to start with the hormonal system. So these are your adrenal glands. There are these cute little hats that sit on top of your kidneys, and what they do is they kind of recognize stress in your body. They react to the stress, but they don't really know the difference with different types of stress. So if we say stress, everybody always thinks, emotions like fighting with your spouse, driving in rush hour traffic, dealing with coworkers or kids and so forth. But the body doesn't actually recognize what that stress is, meaning it doesn't say, oh, I'm going to respond to this stress this way, and I'm going to respond to this stress that way. Your body just responds to all stressors the same. And the adrenal function, when you have adrenal malfunction, then you can see a variety of things. It doesn't have to just come with fatigue, which is what most people would think. You can have elevated blood sugars. You can see a weakened immune system, anxious energy and heart palpitations. Those people that have go to bed at 10 and don't fall asleep until 11:30 or back up at 1 and then wake up, every 1 to 2 hours after that. That's your adrenal glands switching on, starting to become malfunctioning. Heartburn, reflux, or ulcers. Have you ever heard that stress can cause ulcers? It's through this adrenal function activity, irregular or absent menstrual cycles, low libido or infertility, anxiety, depression, low thyroid, chronic fatigue syndrome. So let me show you how this works though. If you see up in the top left, there's cholesterol. Cholesterol is actually the precursor to every single hormone in your body. So if you have cholesterol where it's too high, you might, when you look at the hormonal system, that you might have hormone imbalance because you're not pulling the cholesterol through, so it stays high or it stays in that bucket. Cholesterol goes into pregnenolone. Pregnenolone goes down that left-hand side and turns into cortisol. Before it's cortisol, it's progesterone. So if you have a ton of cortisol, if you're constantly running from the bear, so to speak, and you're stressed out, or even if you have internal stressors in your body, like food sensitivities, parasites, bacterial infection, things like that, you're constantly pulling from progesterone into cholesterol. So we kind of have a bit of I don't know if you'd call it an epidemic, but boy, there's sure a lot of infertility. And, you have to have progesterone. Progesterone predominates for pregnancy. So if you have low progesterone, it's going to cause an issue in the reproductive cycle. Most of us aren't asking the question that maybe it's because you're stressed out and you're producing so much cortisol and adrenaline all the time that you're depleting your progesterone. Up on the top, you see phenylalanine, and then you should see tyrosine right below that. Tyrosine comes down and forms other adrenal hormones like norepinephrine and epinephrine. Tyrosine also goes to the right and forms thyroid hormone. So if you're constantly stressed and you're going all the time, you're also depleting tyrosine, which can deplete your thyroid. So do you see how everything's connected in some way, shape, or form? Your thyroid actually is this beautiful little butterfly gland in your neck, and there is a receptor site on every single cell of your body. Your cells are the smallest building blocks of your body. We're all just literally a whole bunch of cells, but every single cell in your body has a receptor site for thyroid hormone. That's how important the thyroid is. And if you get some sort of malfunction of the thyroid, that too, you don't know, it's not always a clear-cut symptom and then, oh, if I have cold hands and feet, it must be thyroid. But some of the common things we see are weight gain all over, those cold hands and feet, high blood sugars, fatigue, craving carbohydrates, constipation, hair loss. The body sort of, when you don't have proper thyroid hormone, the body sort of starts to slow down. Depression or anxiety, it's one of the most common things I see is anxiety when it comes to thyroid imbalance. And, you know, considering that 1 in 5 women are being prescribed an antidepressant, it could very likely be that your depression or anxiety isn't that you have, you know, it isn't that you have a problem with your brain, it's that there's some sort of malfunction in the thyroid. Muscle aches, increase in allergies or infections, heavy menses, decreased libido, forgetfulness, high cholesterol. So back to, if you're not forming those thyroid hormones, you're going to have more cholesterol because it's the precursor, it's the building block. And if you don't use the building block, it stays where it was originally, stays where it was at, right? So what's the goal? The goal is to get to the root cause of this. The goal is to look at symptoms as warning signs. Symptoms as way clues, your body's way of saying, look at me, do something different. Our job for you is to help you determine what that is. And we do that. That's the cool thing about functional medicine. We have different or advanced testing to help us to determine what your body actually needs. So your thyroid, it actually all starts in the brain, your pituitary gland on that top right. The pituitary gland spits out a hormone called TSH, thyroid stimulating hormone. Makes sense, right? Thyroid stimulating hormone. The thyroid stimulating hormone goes to the thyroid, and I think of it like it kind of kicks the thyroid, like, come on, get going, and the thyroid then spits out T4. T4 is completely and totally inactive in the body, does not do anything for your energy, your mood, your metabolism, your reproductive hormones, your focus. It doesn't do anything until it goes to the liver, the kidney, and the gut to be converted to T3. T3, you can think of that as the football that will go through the receptor site at the cell, tissue, organ, gland, or hormone to create the desired response, to create the touchdown, right? If you are stressed, too stressed, your body oftentimes will reverse that into a reverse T3, which is just like T4, completely and totally inactive. So I bet, you know, I mean, how many of you thought, geez, maybe my thyroid issue is actually a gut issue or a liver issue, that I'm not converting the hormone properly to create the desired effect at the cell, tissue, organ, gland, or hormone. You also can have this thyroid binding globulin, which, think about it, thyroid binding globulin that can get in that receptor site. I think of it like putting saran wrap over the goal so you can't create the touchdown or get the football through. So it binds up that receptor site, and you can see that from things like hormone imbalance, liver dysfunction, adrenal hormones. One of the biggest problems we see are birth control pills that are actually binding up that receptor site. And again, are we asking questions that, geez, maybe, you know, maybe my birth control is actually what's affecting proper function of the thyroid. But the number one thing that causes problems here, 85 to 90% of those with some sort of hypothyroidism, which is more common than hyper. If you do have hyperthyroidism, get a hold of me and we can talk about that. But most commonly we see hypo, and it's because of autoimmunity. So autoimmunity, if your immune system is supposed to get rid of the bad guys in your body, the debris, the particles, the waste, the parasites, the worms, the immune system starts to self-attack. So you've heard of rheumatoid arthritis, multiple sclerosis. It doesn't really matter what the autoimmunity is called because it's named off of the tissue that it's attacking, but it matters where it comes from. So we now know that the number one cause of autoimmunity is related to gut function, because gut is where your immune system comes from. So if you're following me still this far, do you see how everything's connected? And we've got to do proper testing to determine what is actually going on. This is the picture to show you how I think of it like a football goalie. You can get different toxins also that can bind up those receptor sites where the thyroid just can't get to where it's supposed to be to create the desired response. When we look at estrogen and progesterone balance, you really need, with women, you need a proper balance of those, and it does shift throughout your cycle in order to not only have good reproductive cycles, but also we think back, what's puberty? Puberty is where we kind of go into this ability to reproduce. Menopause, we go out of the ability to reproduce. It should be, you should notice a change in the terrain, but it shouldn't feel, it shouldn't feel like you're suffering, struggling, or that it's a living hell to go through menopause, which is what so many women are experiencing, but young girls too. You think about going into puberty, how rough is this for these girls? It should be a change in the terrain. It shouldn't be horrible. So if you're having problems, then again, we need to do proper testing, because the symptoms can come in so many different ways, from decreased libido, the abnormal, it can go from heavy or infrequent, infertility, sleep issues or anxiety. If you have anxiety or sleep issues, have you ever thought that it might be the imbalance of these hormones? We've got to look at these symptoms as clues to do something different, to get to the root cause, and it all starts with proper testing. Progesterone, estrogen imbalance, man, so many things can cause it. Xenoestrogens, you've heard of things like paraben-free, phthalate-free. It's because even companies are realizing now that those are acting as xenoestrogens. Body fat, the more fat you have on your body, the more estrogen you produce. Again, hormone treatments like hormone replacement therapy, birth control, poor detoxification. It's your liver that really has to detoxify your hormones. So if your liver isn't getting it out, vacuuming it up, so to speak, it's going to stay in your system. So we know too much estrogen is bad, but estrogen that stays in your body is really bad. And then it increases the risk of estrogen-dominant cancers, breast, uterine, ovarian. Adrenal stress, high insulin levels. Let's think back to, my girls just turned 13 last weekend, and they bring their own school lunch, but I ask what kids are eating. And if you think about standard breakfast, most kids are maybe starting with cereal, and then they're probably maybe a glass of orange juice for their fruit, or even a banana or something, which is carb, 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 carb. And then they go into lunch, they might have spaghetti with a side of bread, or pizza, or a burger. Again, so carb heavy. Then in the afternoon, they reach for candy or some sort of soda. They get home and they're, do you see how it's like carb, 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 carb? When you have too many carbohydrates, you stimulate the release of insulin, and insulin steals from progesterone. So again, it can create this imbalance where we have to start saying, what's the fuel that we're putting into our body? And is that potentially a source of this imbalance or malfunction in the body? Oops, excuse me. This is a test that we do. This is one of my favorite tests. This was a girl that came in. She was just 14, had had a cycle for a year, and she had cramps that made her stay in bed and throw up at times. The periods were very heavy. She would cry because she was so emotional before her period. And obviously it was a horrible event for her. And what did her mother do? Her mother did what every other father, wants to do for their child, is whatever it takes to help them, whatever it takes to get better. So they went to the OB/GYN. No testing was done, but explained the symptoms, and they were prescribed or told to get on birth control at the age of 14. Mom didn't want to do that, so she started Googling and sought out what her other options were. She came in and we did this test. Now, when you look at the top, there are 3 main estrogens in the body. And estrogen, they should be between the left yellow star and the right. So they should be the green little carrot. You can see how the second one, E2 and E3, are really high. They're way off the charts. So we know estrogen that's too high is a problem if it's imbalanced with progesterone. If we look down the 3 arrows, this tells us how your body is detoxifying them. We know that the 2-hydroxy pathway, the one at the very bottom, protects us against cancer. We know the other 2, the 4 and the 16-hydroxy, actually cause cancer. So if you see, she's very high in the 4 and the 16, she's very low in the 2. It's not a good pattern for somebody. And imagine adding 20, 30 years to that. So we can fix that, work with the liver to properly detoxify. We put her on a short program of care. With her, she was young enough, we didn't have to do very many dietary changes. Very little. Mostly we gave her supplementation and we fixed it. So her periods regulated actually really quick, and in 4 months this pattern switched. Estrogen went into normal values and detoxification was corrected. So there's a lot of studies out there that actually prove this. This is one that I really liked. It suggested that estrogens are, if not properly detoxified, accumulate in the breast tissue and they increase, the risk of breast cancer. We're in our environment today, we're just exposed to things that we've never been exposed to before. They say in 30 days, you're exposed to more stimuli than we used to be in a lifetime. And the debris, the particles, even if you have a very clean diet, what's in the air, the pesticides, the things in our dirt that are affecting our food. We sit more than we have ever sat before. Sitting is the new smoking. It ages you very quickly. And food, in some level, just isn't even food anymore. Women on average are getting a little bit over 200 chemicals on their body before they even leave the house in the morning. So what processes every one of these chemicals? It's your liver. And who processes your hormones? It's your liver. So this is a 4-pound metabolic powerhouse. Its number one job is to protect you, to fix you, to take care of you. But when waste starts to accumulate, the liver can malfunction, and we can test that. So symptoms can range from difficulty concentrating, forgetfulness, headaches, tremors, waking up between 2 and 4 every single night. Skin is a reflection of liver and gut, and we can see high cholesterol, high blood sugars, increase in muscle and joint pain. The point here is that symptoms don't tell you what's going on. Symptoms are clues that tell you to get proper testing to determine what you need to actually correct. So assessing liver function is a test that we do here in the office all the time. But let me tell you a little story. So this was Melissa McCoy. She came in to me. I'll never forget when she sat down for her appointment. She said, I'm tired of seeing doctors. I'm tired of spending money and getting no answers. The only reason I am here with you today is because of the free consultation. And I said to her, that's okay. You're safe. You can come here without any expectation. I promise you, if I can help you, I'll tell you. If I can't, I'll tell you that too. She did agree to do some testing. What we found is that she had autoimmunity, she had hormone imbalance, candida, and high levels of inflammation. We put her on a very specific program of care through nutraceuticals, vitamins, minerals, herbals, adaptogens. We did do diet and lifestyle changes. And she said to me, I'm happy again after a program of care. No more digestive issues, no more brain fog, no forgetfulness, no more sugar cravings, no more anxiety or stress, no more gaining weight. I'm finally losing. My energy is back. I'm sleeping on my own and waking up feeling refreshed. I did ask her permission to share this story with you. And she said, you can, but I want you to tell them one thing. I want you to tell them to stay with the program, continue to fight for yourself, and don't give up. Yost knows what they're doing. Their program works. There will be ups and downs, but you fight through it. I'm so glad that I did. Another patient of ours, and this is Melissa. She's lost 31 pounds. But please don't come to me and say, I want to lose 31 pounds or 51 pounds or 10 pounds. This is not a weight loss program. We did not calorie restrict. We did not calorie count. We simply worked on getting her healthy, and the weight loss was a happy, kind of fun side effect. So Pam was a 43-year-old female. She came in to me a few years ago, joint pain, anxiety, irregular cycles, gosh, horrible problems sleeping. We did testing on her, functional testing. We found autoimmunity, inflammation, and hormone imbalance. And ultimately, we set up a program of care for her, told her we could help her and exactly what that would take. And I'll never forget, she said to me, Heather, the timing is just wrong for me to do this right now. I have holidays coming up. I have travel, and I'm going to have to get through that, and then I'll call you when the timing is right. So she ultimately decided not to do anything at that time. So 2 years later, she came back and she said, now my joint pain is daily, and my anxiety is affecting my ability to do things that are important to me, like travel with my family. We did testing, and she has 2 autoimmune markers. Her inflammation is up, and she's pre-diabetic. So that's what we try to avoid. We try to help patients avoid suffering so they can live their best life symptom-free. Pam can't get those 2 years back. So in summary, symptoms, they don't give you the solution. They're clues, everybody. They're warning signs that you should do something different. And that's where that's where we come in. I mean, we can do thorough functional testing, find what your body is trying to tell you, and start to rebuild the body. If we can help you, we'll tell you. If we can't, we'll tell you exactly what you need to do next in order to get the results that you're looking for. So for those of you that want to figure out your body, for those of you that want results, for those of you that want a doctor that will fight for you and help you find answers and solutions, please give our office a call at 515-278-4325, 515-278-4325. You can set up a free, absolutely no obligation consultation with one of our doctors to determine what the next best step is. We would do thorough comprehensive blood panels. Typically they're about 275. We look in the beginning, we look at those 7 autoimmune disease panels: nutritional levels, inflammation levels, cardiovascular disease risk factors, all 8 for the thyroid, complete metabolic panel, immune function candida. All testing is done at cost. There is no risk for you to do this to find out what's going on with you. Then on the second visit, we'll review your lab results with you. We'll tell you if this is the next best thing for you to do. Then we're going to outline if there's any additional lab testing we need to run based on what we see in the first panel, and we'll go over frequency and length of care and expected cost of care. Our programs of care, initially, we see patients every 2 to 4 weeks for 4 to 6 months, and then we retest. So you're always getting befores and afters. We, as a multi-doctor office, I think what sets our office apart is that we work together on every single patient, and we're on call for you 7 days a week. So I guess I'm through. But before I go, I want to leave you with something. I want you to know that I guess I don't hope that you leave here and do something to change your life. I don't hope that you do great things with your life. I don't hope that you can look at your body differently necessarily or change something. And here's why. I am expecting it. If you're suffering, I'm expecting you to do something. Take that first step. Do something to change your health, to start to turn the trajectory and put you in the right direction. And not just for you, but for your friends, for your family, for your children, for your coworkers, for your future. Because every move you make, every action you take, every action you don't take is creating your future. Change the way you think, change the things that you do, and things will change for you. It's been an honor to have you here. Thanks for coming. Have a great rest of the day.